We continue our SportsCenter special tonight, and what you are seeing on your screen is a sign that has been on the gates leading into our headquarters in Bristol, Connecticut for several months now, and I have a suspicion those words will stay up there for quite some time to come. And we continue right now, and we're delighted to welcome Dr. Jennifer Ashton, who is the Chief Medical Correspondent for ABC News. And Doctor, thank you. And here's what we did. We solicited questions from our viewers. We thought, who better to ask you questions about sports and its connection to the coronavirus than sports fans themselves? So these are essentially the questions the sports fans wanted answered. And let's start with this. So many sports fans enjoy the experience of going to games. And so the first question is, at what point should a fan feel safe going to a stadium or an arena to watch their team play?
Great question, Mike, and not an easy answer. You know, at ABC News, we've been speaking to the top infectious disease specialists, public health officials in the country since the beginning of this pandemic, which, by the way, even though it seems like it's been forever, is only about 6 months old. And there's not an easy answer to that because everyone has to stratify their own risk. So you have to weigh your risk tolerance, the benefits of going, the benefits of not going, the risks of going, the risks of not going. Now, there are some facts that people can go by. According to the CDC and Dr. Anthony Fauci, you know, the propensity of people to get this virus will depend on time, it will depend on location, it will depend on the city. So if you're in a hot spot and there are a lot of cases, maybe the answer to that question is no, you're not going to go to a sporting event. But if you're in an area of the country where the rates of COVID-19 are relatively low or stable, then maybe the answer is yes.
Now, the next question is one that you should be somewhat intimately familiar with because your daughter is a Division I hockey player, and it pertains to the sports like hockey and football and basketball where social distancing is just not an option. So if one of those athletes were to ask you, Doctor, am I safe going back to play? What is the answer?
First of all, there are risks with any sport, right? We know that very, very well. Certain sports higher risk than others, but according to top infectious disease specialists, it really comes down to 4 things. Time, how much time you have exposed to someone else or a group of people, the space apart you are from that person in a sport like ice hockey, other sports, you're inches away, how many people or how densely crowded the area is, and whether you're indoors or outdoors. All of those factors we think right now are important to be able to kind of stratify. Are you in a low risk for transmitting COVID-19 or are you in a high risk? And the umbrella over all this, Mike, is that at this point we think that a very high number, 25% or more of people infected with COVID-19 can show no symptoms at all. So that definitely complicates things.
All right, 2 final things I want to ask you that feel like general questions, but I think there's something that so many people have on their minds. And the first is this. We keep hearing talk of a second wave of this virus that may come when the weather turns cold again at the end of the year into November, December, and that obviously has an impact on the sports calendar, among many other things. What do we really know about that?
We don't really know a lot about a lot of things here. There are absolutely more questions still than answers, and everyone wants to rush to give some definitive fact. But in covering this story every single day for basically the past 5 months, one thing has been made crystal clear. We don't have a crystal ball. We don't know what's going to happen in November or January. We can look back and look on behaviors of other pandemics, other respiratory viruses like influenza, other coronaviruses, and try to piece some things together. But this virus is unknown. We don't know how this virus will behave in the future. We don't know how our influenza season will be in the future. So anyone who tries to forecast that or make a prediction is doing just that. They're making a prediction. And in medicine and science, we really like to go by hard facts and data as much as possible.
And so I suppose the best way to close this, people would just like to know when this is going to be over, which means a vaccine. I feel like I read a lot of conflicting stories about that. What do we know for certain about the progress?
I've been in constant communication with Dr. Anthony Fauci about this. He is cautiously optimistic, as he said multiple times publicly, emphasis on the word cautiously. We have to remember that the fastest vaccine ever made Previously took 4 years. So yes, there's global collaboration. Yes, there was a little bit of a head start on this vaccine because of research done against the SARS virus. And yes, there's a lot of smart people working on it. But remember, it has to be tested. Right now, we're about to go into phase 3 clinical trials, about 30,000 Americans volunteering to be tested. And then if safety and efficacy are proven, if everything continues to go smoothly, we have to make about 500 million doses of that vaccine at least, which already is starting to be ramped up at investment risk, not medical risk, but risk in that they're already starting to manufacture those doses. So fingers crossed, is it a possibility that we could have a vaccine by, let's say, January, February? It's a possibility, but we also don't know how this virus will evolve and change, not just here in the U.S., but globally. So again, dynamic, evolving, uncharted territory, a lot of questions right now, and we will stay on top of it.
Dr. Ashton, this is such important stuff. We thank you so much for your insight here tonight. Thank you for sharing this time. We appreciate it. We'll check in again soon. Thank you for watching ESPN on YouTube. For live streaming sports and premium content, subscribe to ESPN+.